Well, yesterday we reported that a study has found that menstruation is not significantly affected by any COVID-19 vaccine. The Society of Obstetricians and Gynaecologists say the jab may only increase the cycle length by just under a day. But the Commission for Gender Equality has been slammed by the Health Department for making false claims about vaccinations for women. And to clear the air, we've booked an interview with our busy Health Minister, Dr. Joe Phaahla. Thank you so much for your time, Doctor. It's wonderful to finally chat to you. Doctor or Minister, whatever you prefer, I don't know. Let's just clear up here your views as the Health Department and all the health professionals that you consult on a regular basis about the impact of the vaccine on a woman's menstrual cycle.
Thank you very much, and thanks for giving us the time to clear up this matter. Well, we believe that the Commission for Gender Equality went really far beyond its scope of jurisdiction, in the sense that it comes across an article which speaks about the fact that a woman's menstrual cycle may be altered in terms of the length, and then on the basis of that, then issues a public statement on which then it says that because of this kind of information, organizations and institutions which are considering mandatory vaccination in their either workspace or in their institution should not go ahead because of the fact that there is this kind of information, and therefore some women may actually be worried about that, suggesting basically by going public on this, suggesting that this is actually significant. But in the same statement, they then go on to say that medical experts believe that this is not significant. But the mere fact that they use it as a basis on which to then go and say that this is one of the reasons why any institution which is considering mandatory vaccination should think twice. I think this is, in our view, very unfortunate and far beyond the scope. They should have consulted, medical experts. They could have even spoken to us to refer them to appropriate experts in this area. And we feel that this was quite unfortunate. It just adds on to the vaccine hesitancy and the anti-vaccination campaign.
So is there an impact at all? It's still very early days, I know, in terms of research, but is there any impact, even if a mild one, such as an extension of a cycle, on a woman's menstruation with regards to any of the vaccines?
Well, we must remember that there are many medications which all of us take, including women who are still within their menstruation age. Now, many of various medicines which we take do have, some effect on some element of our body system, metabolic system, and in terms of a reproductive case for women, there are a number of things which may have very small impact. And when you look at any of the medications which all of us, for various reasons, take, there might be some impact, small one, which is insignificant. As I say, even in the study which they are quoting, the study itself says this is insignificant, as it is the case with various. If we're going to rubbish various forms of treatment on the basis that they may have some insignificant impact on some aspect of the body system, then we'll run out of any treatments for various ailments. So that's why we say that this was very irresponsible to equate this, therefore, as some form of justification for saying that various institutions should think twice before they consider mandatory vaccinations.
I mean, Minister, you could just look at the side effects pack on a packet of Panado, and you'd see loads of contraindications and side effects. So, you know, everything is going to have something, I suppose, any medication. I wanted to ask you about the safety of vaccination teams. I believe there was an incident. Do you know exactly what happened and if safety for those vax teams have been ramped up?
I've just seen on one of the communications from the GCIS that a team of vaccinators in the Tshwane Metro were attacked by criminals who robbed them of their cell phones and other equipment such as laptops. So at this stage, we're still waiting. I will be talking to the MEC for Gauteng just to get more information. It's quite sad that, you know, it's the same thing which we experience with our emergency services, where emergency health workers going out on call get attacked and robbed. So, you know, it's almost impossible. I think the same thing as we had from the MEC of Education in Gauteng, where, you know, people, I mean, the officials in the schools get attacked and some of them killed. This is really reflects a very sick society, because these are the people who are trying to do everything to save lives, and for them to be attacked for just to be robbed of their equipment, this is quite bad, and we call on society to really help us in preventing such acts of criminality. At this stage, we're not aware that the vaccines were the target. It looks like they were basically targeting these very important gadgets, which are used for registration of the people who are coming forward to receive the vaccines.
Very disappointing, because they're doing such an important community service for all of us South Africans. Doctor, what are your thoughts on calls from some health professionals for an end to the state of disaster?
We do understand this, and I think the president has also indicated on a number of occasions that we're not having the maintenance of the state of disaster because either himself or members of the cabinet or the health ministry likes to keep it that way. We're doing that because at this stage, it's the only mechanism which we have to try and assist our society in terms of mitigating against the risks of the spread of COVID-19, which is still very seriously in our midst. We're still recording between 2,000, 4,000 new infections per day, but we also know that there's a lot more who are asymptomatic and therefore who we don't even know. But we know that while the majority of cases are mild, but there are also people who are very sick. We still have just under 8,000 people in hospital, just over 700 in ICU. So it's still a very serious illness. We're looking at other measures as the strength of the virus seems to get less, as you know, the fourth wave, it's in terms of its impact starts to reduce. We're looking at other ways in which we could actually mitigate to help society to avoid the risks. So we're exploring various ways because we know that the risks such as huge gatherings, people getting too close to each other, the wearing of masks still very important. There are all those preventative measures which we would like to find ways in which government should assist society to keep. So we're exploring other ways within the health regulations through which these measures, some of these measures could be retained. So people must just be patient. We're working on this, and very soon we will be able to announce new measures which will be far less restrictive in terms of assisting us to mitigate against the spread of COVID-19.
Doctor, before I let you go, something that I've often wondered about, to be the Minister of Health now during a global pandemic, Captain COVID, steering South Africa's ship, it must be an incredible burden and a challenge. What has been the most difficult part of you taking the helm at this very difficult time?
Well, it is indeed a difficult task. Somebody has to do it. But I must say, one works within a very supportive team from the president, members of cabinet, and within the department, the Coronavirus Council, the provinces, very committed MECs and HODs, but also especially our health workers. So our health workers in the front line are indeed our inspiration. The difficulty really at this stage, which we are all grappling with, is to really, that compared to where we were just over a year ago, in middle of 2000, when the COVID pandemic started, and when we only relied on what you call non-pharmaceutical interventions, the health measures, we now do have vaccines which have been proven over the last 3 waves to be very effective. The fact that we still have people out there who are waging a war against the vaccines, that's really the most frustrating. And one is hoping that more and more South Africans can really, come to accept the fact that we do have these vaccines, which are very important in terms of, which can enable us to almost get back to normality, to get normal economic activity, normal social activities. So, one is hoping that at some stage we will be able to get into the hearts and minds of the majority of South Africans to come forward and take the vaccines, which are life-saving.
All right. Thank you so much for your time today, Minister. I know that you are working apparently 14-hour days sometimes, so it's much appreciated.